Today I am going to discuss about the peripheral blood smear and DLC, differential leukocyte count. So we know the different type of leukocyte we have is the neutrophil, eosinophil, basophil, lymphocyte, monocyte. These are the different type of leukocyte. So we'll discuss about the differential leukocyte count. Usually blood test can be done within a few hours, but in case of peripheral blood smear, you prepare the slide and you can preserve that slide even for months and years. So other uses are so many, like detection of anemia based on the size. So prepare the peripheral blood film or smear, and then you can put under the microscope and see the size of RBC, then content inside the RBC. So if size is smaller, then you can say microcytic. If content is less, then you can say hypochromic. If size is bigger than normal, then you can say macrocytic. Shapes may be different, like sickle cell anemia, then spherocytosis, and different type of RBCs. Means abnormal RBC you can detect. Different type of blood cancer we can detect. Then also we can use for malaria parasite, infected RBCs. So inside the RBC we can detect the under the microscope malaria parasite. In cancer patient, after chemotherapy we can check the effect of chemotherapy and the cells, blood cells. Now we are going to discuss about the DLC. With DLC we can detect the different type of infections. It may be bacterial, pyogenic, then parasitic infestation, viral, chronic diseases like tuberculosis. We have different type of leukocytes, DLCs. Their number will change in means increase or decrease count in different type of situations. This test is actually correlated with the TLC, total leukocyte count. If you do the TLC, total leukocyte count, it will give a better picture. For DLC, differential leukocyte count, we need glass slide. Firstly, we need compound microscope. We have microscope here. Then pricking apparatus to take blood sample, to collect blood sample. This is the spirit soap. Then Leishman stain we need. So to stain the cells, and then we can count it. Then we need distilled water or buffered water, which pH 6.8. Cedarwood oil usually we use. If cedarwood oil is not there, then we can glycerin. We can use the glycerin, or we can use the liquid paraffin. As the liquid paraffin and cedarwood oil or glycerin, they have refractive index similar to that of glass slide. So think about the principle. For that, here a drop of blood is sprayed on a glass slide. Okay, so we have a glass slide. Suppose this is a glass slide. So we have to take one drop of blood and spread on the glass slide. The film, after being dried, is fixed with the acetone free methyl alcohol. Okay, so here we turn. First we'll take the blood drop, and then we spread this blood drop to the glass slide, whole glass slide. We can cover this. Okay, after that we have to dry this blood film, and then we have to fix it. So how we'll fix it? With acetone free methyl alcohol, then stained by suitable acidic and basic dye, so that the different cells can be identified and counted. This blood size is medium size, not so big and not so small, medium size blood drop. Then what we can do, we put the spreader and spread this blood film and make the blood film. Okay, after that we have to dry it, and then we have to fix it with acetone free methyl alcohol, and then we have to use dye and count it. What is the ideal blood film? So ideal blood film, few points you must remember. One is it should cover 2/3 or 3/4. 2/3 or 3/4 of glass slide. Glass slide means this is the glass slide, and this blood film should cover 2/3 or 3/4 of this glass slide. Shape of this blood film should be tongue shape. Then this is a single cell layer. Thin we cannot use, so it should be single cell layer, means cells should be separated and not overlapping. Cells should not be overlapping. Then this all the margins should be filling. So then it should be free from any vacuoles. So how will you make this vacuums free? Or to clean the glass slide before any procedure and make it grease free with the soap and water, and then dry it over the sprit lamp and then make it grease free. Or you can use the new slide. If slide is new, we don't need to wash it. Make sure that your glass will be fully grease free or oil free. Actually, if oil will be there, so in that particular part cell or blood film will not stick on that particular part, and that part will be look like a vacuole or vacant part. So margin should be free and no vacuole or no serration or linings. During the preparation of the blood film, you should prepare the blood film in one go. If you stop in between like this, then there will be a straight lining. So these are the basic precautions we should take during the preparation of glass slide, and this is called ideal blood film or ideal blood smear. So composition of Leishman stain is very important. So 0.15 gram Leishman powder in 100 ml acetone free methyl alcohol. So we have to use 0.15 gram powder, and that powder is actually nothing but 50% is eosin and 50% is methylene blue, methylene blue. Half of this 0.15 gram is eosin and half of 0.15 gram is methylene blue. In some book you may get 0.2 gram, so that also okay, which is dissolved in 100 ml acetone free methyl alcohol. This part is very important, acetone free methyl alcohol. So eosin is an acidic dye. So this acidic dye is actually negatively charged, and stain positively charged basic part inside the cell. So that is RBCs actually and granules of eosinophils. So next thing is methylene blue, second part of this Leishman stain. What is that? Methylene blue is a basic dye and it's positively charged. It stains negatively charged acidic particles. Clear? Part of the cell. So what are those? Is a cytoplasm of cell and nuclei of the WBC. So cytoplasm and nuclei of the WBC and granules of basophils. Then third component is acetone free methyl alcohol. Here we have methyl alcohol, and that is actually acetone free. If we use acetone here in the methyl alcohol, so it will decolorize the cell, and whatever you are using the eosin methylene blue, it's not going to work. So that's why we use acetone free. Then why methyl alcohol? Methyl alcohol is going to act as a fixative. So what fixative? So we have prepared the blood film on the glass slide, and that blood film will be fixed by the methyl alcohol. What are the function of acetone free methyl alcohol? It is going to act as a fixative, as well as it preserves the cell in whatever chemical metabolic state that are at the time of staining. Then the blood smear also get fixed to the slide by the precipitation of protein in the by alcohol, so that may not washed off. So who is going to fix this blood film, and how your blood film will be fixed on the glass slide? By the methyl alcohol. Protein present in the cell membrane will be precipitated, cell membrane of RBC, WBC, and that will be precipitated by the methyl alcohol and fixed on the glass slide. Acetone, here we have function of acetone, cause shrinkage of the cell obviously, and may even produce crenation, indentation and lysis of the cell. So we can also, lysis of the cell is also possible by the acetone. So that's why we cannot use the acetone. See here, this is the Leishman stain, Leishman solution. So this blue color solution we can use. So let's talk about the procedure of, we have everything, we have microscope, glass slide, and everything should be clean and dry. Glass slide should be clean and dry. How will you clean your glass slide? With soap and water, but I'm talking about the reuse of the slide. So for reuse of slide, you must wash your slide nicely with soap and water, and then dry it, and then put for some time over the flame. So you will get the sprit lamp like this, a sprit lamp. So this lamp contains a sprit. Over the flame, you just put your glass slide for some time. On top of that, move your glass slide right and left, and then make it grease free. And after that, that clean surface you can use. So this is a clean surface, so you can use this surface. Okay, and here we can take 1 drop of blood. So here we can see this glass slide, and usually we take 2 to 3 or 3 to 4 glass slide. Why 2 to 3? This procedure takes some time. If you prepare one and if your preparation is not good, then again you have to repeat the procedure from starting. So it will take lots of time. This is the blood drop. Here you can see, and in front of the blood drop you are putting your spray drop, and hold this slide here with your fingers at the tip and pull this. You can see here. So you pull the spreader and blood will spread inside the inner margin of the glass slide, and making the angle of 45 degree, maximum 30 to 45 degree you can use. If you increase or decrease the angle, then your thickness will change. Ideally we should need the single cell layer. So if you maintain this angle 30 to 45 degree, your cell more or less will be the single cell layer. If you increase or more than that or decrease that, then your thickness will change. And after that, what we can do, holding this tip here, hold this area with your tip of the finger, the 2 finger, and making this angle of 45 degree and spread it forward. One go to the end, till the end, and then you will prepare the film like this. That is called tongue shaped film, ideal blood smear. I have already explained what are the characteristics of ideal blood film. So again repeating, it should be a tongue shape. It should cover 2/3 or 3/4 of the glass slide. All the margins should be free. Blood should not touch to the margin. Then thickness should be single cell layer or not, neither too thick or too thin. Free from any serration. How will you free from serration? You should select the spreader with a smooth margin, then free from vacuoles. Glass slide having some oily thing on the surface, then and that particular area blood will not stick, so you will see the vacuoles. Spread should be in one go. So if you are spreading, this should be not like this, not like this. If you are stopping in between and you are going, then you will see lining like this. If your margin is not smooth, then your lining will be like this. That you should learn about the ideal blood film, and after trying we can move for the staining part. So how will stain? The Lisman stain. So for the first thing, we should prepare the blood film. So blood film is prepared, and after preparation we must dry it completely throughout the blood film. So this, suppose this is slide, and now blood film is here. You have blood film, this blood film. Now what we can do, we can put Lisman stain. Where? This is the Lisman stain. How much? We can put Lisman stain to cover this blood film. How? 1 2 3 4 5 6 7 8 9 10. Means we have to put as many as drop we need to cover this whole blood film. It may take 8 drop, 10 drop, 12 drop, whatever, just count it. So suppose here we need 10 drop and here is 12 drop. So now we have wait for 2 to 3 minutes. First thing we will do the preparation of blood film. So blood film is prepared, 2 to 3 slide we prepare. After preparation we dry it immediately by waving it, and then we have to put Lisman stain. How much drop? Usually take 10 to 12 drops. So just count the drop, wait for 2 to 3 minutes. Why 2 to 3 minutes? For fixation. It's not the staining. This is not a staining, but actually this is the fixation time. 2 to 3 minutes is fixation time and not a staining time. Why? Even though this Lisman stain contains eosine and methylene blue, but it's not going to penetrate the cell. It's till now it's not ionized. That's why eosine and methylene blue is not going to penetrate the cell membrane and not going to stain the cellular material inside the cell. That's why even though eosine and methylene blue is present on this Lisman stain and you have already covered this blood film with the Lisman stain, it's not going to stain the cell or component of the cell, but only going to fix the cell first 2 to 3 minutes. Clear? So first 2 to 3 minutes is fixation time and not staining time. So it may be suppose 3 minutes now. After adding the Lisman stain, it's now 3 minutes over. So now what we can do, we can use distilled water, same drop. So suppose here you have used 10 drop and here 12 drop. So same drop 10 Here in the case of 10 drop, or here in this slide you have to use 12 drop distilled water. And after that we use the blower to mix that, and then we'll wait for 7 to 10 minutes. 7 to 10 minutes. And this 7 to 10 minutes is actually staining time. So first 2 to 3 minutes is fixation time. Which part will fix? Methyl alcohol present in the Leishman stain. How methyl alcohol will fix or blood film to the slide? By precipitation of protein. Clear? We are going to demonstrate you the procedure how to do that. So first we are going to use the glass slide. So here we can see we have glass slide, glass box. So this is a new glass slide, so that's why we don't need to clean it, so we can directly use that glass slide. Otherwise we have to. So 2 glass slide we are using. This is another glass slide, and always touch from the side and not on the surface. So like this you should always touch, because if you touch on the surface, then well from your fingertip will stick on the glass slide, and again there will be chance of vacuole on the blood film. And we have blood sample here. We can directly prick our fingertip and put the blood drop here, or we can use the blood sample, anticoagulated blood sample, obviously. So here we are going to use anticoagulated blood sample. Yes, this is 1 drop. Yes, away from the margin we can see here, this is the blood drop, and this is the another blood drop, a medium sized blood drop. This is a medium sized blood drop. And now we are going to use a spreader. So let's see how we can use the spreader. So spreader should be in the front. Must check your spreader should be with a smooth margin and in front of the blood drop. So blood drop is here, and putting the spreader here and pulling backward, so blood will spread throughout the margin. See, the blood is going to spread throughout the margin, and I have in one go we have to spread this whole the slide, one go. See, I have turned the backward, it's going to spread, and in one go without stopping I have to do it. Yeah, blood completely wait, allow the blood to spread completely. Yeah, see, this blood film is prepared. Maybe, yeah, this slide is good, you can see. And now we can move this slide, both the slide, to dry it completely, air dry. So now slide is prepared and it's already dry. See, this slide is already dried, but this, yeah, here we can put Leishman stain. So see, this is a Leishman solution, and composition you must know, so please read about the composition and function of each and every component of Leishman stain. So I am putting Leishman stain 1 2 3 4 5 6 and count the number. So always we should count the number. Why? We should add the same, and timing is important. So number of stain and timing, both are important, because we have to wait for 2 to 3 minutes for fixation. So this we are adding Leishman stain, but this is not going to stain actually. Now this is going to fix actually. So drop number of drops Leishman stain, the same drop we will need distilled water. Here we can see this covered already with the Leishman stain, and after 2 to 3 minutes, yes, we can always move. We should not let it dry, so you should always look for that. So while waiting 2 to 3 minutes, we should not let it dry. So if this solution will dry Leishman stain, then there will be a dark color patch will be there to keep it wet. Now I am going to add distilled water. So distilled water, same drop after 2 to 3 after 2 to 3 minutes. You can choose any, it may be 2 minutes, 2 minutes 30 seconds, or 3 minutes. Then I am adding the same drop of distilled water, and now we will wait for 7 to 10 minutes. 7 to 10 minutes is for staining time. First 2 to 3 minutes was actually fixation time. Fixation time. Fixation time was first 2 to 3 minutes. Which part of litmus stain will fix your slide? Methyl alcohol. Acetone free by precipitation of protein present in the cell membrane. After adding distilled water, we wait for 7 to 10 minutes for staining. So because distilled water will actually ionize the solution, and then the solution will go inside the cell, penetrate and stain it. And after that we should wash it. Let me show you how. It is over. So first discard this fluid. As 10 minutes is over, extra fluid, we should discard it, and then we should wash it under the tap water. So I am taking it under the tap and open the tap slowly. Slide open the tap, few drop, yes, and then we can wash it here. So that under the tap we should keep our slide like this, and this, then we can wash it. So just opens slightly and then allow water to fall here, and this will go through this area to wash it to appearance of pink color, light pink in color. So it's already completely almost washed, and now it appears slight pink in color. See, this is actually pink in color. And now I am waiting for the dry. So this second slide I am going to wash it. Again the same procedure, we should completely wash it. Second slide. Yes, it's already done. Yes, this slide is very nice. Color is light pink in color. So this is a good slide. Wait for the dry and then we can use this slide. Here I am going to show you the how to use old slide, means reuse of the slide. So first of all you have to clean your slide with soap and water, means wash it nicely, and then make it grease free, grease or oil free. But if you are going to use new slide, then you don't need to wash it, or you don't have to clean over the slide, clean over the flame. So this is the spirit lamp. So flame is here, and this lamp is filled with spirit actually. Now we can use the blood sample collected in the anticoagulated vial, or we can use directly after picking the finger. So usually we select the left ring finger, and first of all we have to clean it with a spirit soap, then wait to dry, and then we can flick it. See, here I am going to show you one more thing, how to put your slide over the flames. You should hold your slide from the side and not from the surface, any surface. So this is the way we can put slide over the flame to make it grease free. So grease will be evaporated, or oily thing will be evaporated by the use of this heat. We have cleaned with the spirit soap. That surface we should use after cool it down. We can use that surface, particular surface. Yes, I'm going to use that particular surface which is already cleaned. First soap and water, and then over the flame. See here, I'm cleaning this another slide, and then the surface I have already cleaned over the flame. I'm going to use that surface. And this slide I'm going to use as a spreader. Now I'm going to pick the finger after the, yes, I have already cleaned finger with a spirit soap, and after drying I'm going to pick it, and then we'll take few drop of blood, full depth. So this lancet is sterile, and you should always prick with the full depth, around 3 to 4 millimeter depth, and deeply, means free flow of blood should be there ideally. Then another slide I am asked and how to prepare the blood film. So I will show you again in another slide how to prepare the blood film with the collected blood sample. So 45-degree angle is there and I am allowing blood to, yes. So this is the way we can make the blood film. I will again repeat this procedure so it will be clear for you. And now I have to dry it immediately by waving it in the air. Why? Because if we will keep it, then it will dry, but it will take longer time and there will be a chance of blood cell to shrink and you will not get the cell on actual size. Size will change, morphology will change. So that's why we should always dry it by waving in the air immediately, as soon as possible. Yes. And let me show you how to dry it and make sure that your slide completely dry. Yes. Then now this is a Leishman stain. I have already told you about the composition of Leishman stain. So please read. You must know the composition and function of particular. So now I am going to put Leishman stain on the blood film, drop by drop to cover completely, and I will count the drop. So here I am going to put 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 10, 12, 13, 14, 15. So 15 drop I have put 16. So 16 drop. So drop we have to count to cover it. How many drops you need to cover all the blood film you have prepared. So now at this point of time I have wait for how much time? 2 to 3 minutes. Why 2 to 3 minutes? See how 2 to 3 minutes for fixation time. To fix the cell or blood film on the glass surface. So now it's around 2 minutes 30 seconds is already over. So fixation. So now I am going to add what? Next thing is distill water. How much drop? Here I have added 16 drop. 16 drops of Leishman stain. So now we have to add distilled water 16 drop. So it's already 3 minutes. So I waited maximum time. You can wait 2 minutes or 3 minutes. So now I am adding 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So 16 drop we have to add. So it's done. Now we have to mix it. 5. We have to mix distilled water and Leishman stain so that both the solution will be mixed properly and the solution will be ionized. So this is the way we can also use this. Either you can use blower or any other thing to mix it. And after that 7 to 10 minutes over. Now I'm going to wash it. So you have already seen. So 7 to 10 minutes over. Now I'm washing. How to wash it? So you can directly put under the tap, but very careful. Tap should be open. Less amount of fluid you can allow to come out from the tap, and otherwise your all the blood will come out with the force of water. Or you can use another slide to put under the tap and the water from other slide indirectly after the slide it will fall on the your blood film, so it will wash and then it will appear as a slightly pink in color or pinkish blue in color. So this color is very good. Now it's we can put this inclined position to dry. This slide is already dried completely, and I am going to use this slide to see under the microscope. First I will focus on the screen it low power, then high power, and then finally I will count it under the oil immersion, which is 100 x objective lens. So 100 into 10, total magnification will be 1000. So I am drying it by waving it because this is not still not completely dry. So we should dry it completely. So now I am going to focus this under the microscope. This is the light source, this is the stage, this is sub-stage where we can see the condenser and diaphragm to adjust the light, and this is the fine adjustment and coarse adjustment is here. This is the adjustment. So inner one is the, yes, let's see, this is the light source, this is the stage, this sub-stage which contain condenser and diaphragm to adjust the light, and this is the adjustment, fine and coarse adjustment is here, and this is the rack to move rack forward, backward and side by side. So this direction, both the direction we can move rack. So with this we can move the rack, and this is the fine and coarse adjustment. So inner one is the coarse adjustment, move up and down, and side one is fine adjustment, slight movement of sliding to focus it better. And this is the increase the height of stage and sub-stage. So this is sub-stage. So condenser and diaphragm is there, so we can use for that. And this is the eyepiece, and this is the objective lens, nose, this is nose piece, and this is objective lens. So 4x, 10x, 40x and 100x, 4 we have objective lens. So we can just, and these all are arranged in parafocal arrangement. So here this light is passing through this aperture, open area in the stage, and that light is controlled by actually this diaphragm and condenser. We are going to focus our slide, which is already prepared. We have prepared the slide and focusing it. So put under the microscope on the stage and fix this. This is the low power objective lens. So this is suppose 10x. So total magnification will be 10 into 10. So objective lens 10 and eyepiece is 10. So total 10 into 10 is equal to 100x. You can move your slide in this direction or this direction or this direction or this direction with the help of this. So any direction you can move. And a stage, you can move a stage up or down with the coarse adjustment. This side we have coarse adjustment, and this is fine adjustment actually. Yeah, see, these are actually cells. These small things are actually cells. Here in this slide we have everything, RBC, WBC and platelet. So we will see so many RBCs, and in between RBC you will see one or two. So one or two WBC. So we will get hundreds of RBC in one slide and one or two WBC of different cells. So like that. So we will get, wow, this is a very clear picture. See, this is the cells. These all are cells actually. But as magnification is very low, so size is very smaller. I am going to change the magnification power now. It's around 40x high power. I am adjusting the light with the condenser and diaphragm. So diaphragm opening, because we are using the 40x objective lens, so diaphragm should be mid open usually, and condenser should be always in the mid position, not so high or not so low. So see under the 40x microscope. So it's, yeah, cells are visible, but it may not be that clear. So now I am going to move into the 100x. For that we have to use the oil. So cedar wood oil is here. So we can see here oil. So that is cedar wood oil. Usually we can use cedar wood oil. Other oil we can use is a liquid paraffin or glycerin. Why we can use? Because the refractive index is almost similar to that of glass slide. If you this is oil immersion 100x. So it's almost touching. This oil immersion will almost touch the glass slide, and whatever gap we left, few millimeter, that gap will be around 2 millimeter, and that gap will be filled by oil, the thick oil. And when we'll move the slide left and right and side by side, then this oil will also move with that slide, because oil is sticking here, and when you move the slide left and right during the counting, it will also move. Yes, so this is the 100x, or we can say OL immersion 100x objective lens. So total magnification is 1000x magnification, and here we can see the cells. So this is actually lymphocyte, and these all cells are actually RBCs.